It is officially back to school, and that means our kids are going to be exposed to many more people and all their germs. But that also means sports, playing at recess, and lots of opportunities for those uh-oh moments. So today we welcome Mayo Clinic emergency medicine physician Dr. Brittany Beel to talk with us about some back to school safety issues. There are so many to talk about, but let's start with the basics. What would you say in general should we be thinking about as the kids go back, particularly with the fact that COVID's still lingering?
Right. So definitely if your child has any symptoms of COVID, I recommend getting tested. Particularly if your child has a fever, we typically recommend that you keep them home for at least 24 hours with them having a fever. And then also if they're vomiting, make sure they stay at home, because the last thing that we want is for the other kids to get the same symptoms that they're having.
And that really comes to play. Any child that has a fever probably shouldn't be going to school anyway.
Exactly. So yes, any child with a fever, stay home for at least 24 hours without having a fever, and then you can think about going back to school.
All right, what about the playground? We know a lot of things can go wrong on the playground, especially, you know, these kids, they've been cooped up, they get out and they want to go crazy. What are some of the things that you recommend for trying to keep the kids safe?
Yes, definitely. So we see over 200,000 visits in the ED every year across the nation, just based off of playground injuries alone. Some of the more common injuries that we see are fractures, falling from monkey bars, and concussions, things like that. So it's very important to keep in mind to make sure that your child is playing on age-appropriate equipment. So if they're super young, they shouldn't be on the monkey bars. Making sure that backpacks and other large objects are out of the way. Things that they can trip over, things like that.
All right, we know, it's Florida in the summer, and it is so miserably hot. Florida and Georgia, both known for their heat. And kids are not always the best, just like they're not good about grabbing a coat when it's cold. They're not good about staying hydrated. What recommendations do you have there?
So definitely hydration is key, hydration and also electrolytes. So whether it's Pedialyte, Gatorade, things like that are really important to pack in your kids' lunch boxes to make sure that they're staying hydrated. So water, and then also Gatorade or a Pedialyte or something with electrolytes.
And I think one of the scariest things, especially as the kids go back to sports, is head injuries. What do you recommend there? I mean, I know all parents are just absolutely afraid of their child having a head injury.
Right. So concussions are the main thing that we see a lot of times in the emergency department. Concussion being a mild traumatic brain injury. One of the things that you look out for as far as does my child have a concussion is, are they having memory issues? Are they having vomiting? Are they confused? A lot of times parents aren't sure when to bring their child to the emergency department, but I always like to say, if you feel like your child's not back at their baseline, if you feel like there's something off, absolutely bring them to the emergency department. Some of the things that you can look out for as far as red flags would be, is your kid having seizure-like activity? Are they having repetitive vomiting? Did they lose consciousness? Things like that.
And one of the things I think people struggle with, parents struggle with, is at what point do I need to take my child to the doctor? After an injury, should I go to urgent care or should I go to the emergency department? Do you have any general advice on that?
Sure. So, I mean, I recommend if you think that there's something wrong, if you feel like your child is not who they normally are, always seek help, whether it's an urgent care or an emergency department. Emergency departments, we have imaging and we have things like that we can do, but whether it's your pediatrician, an urgent care, or emergency center, definitely getting checked out is better than not doing anything at all.
Get them in the door.
Yes.
All right. Dr. Brittany Beel from Mayo Clinic, thank you so much for being with us this morning.